This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPH.D or Odyssey.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the Ph.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
If you want to get healthy, you've come to the right place, right? Good morning and welcome to another edition of Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with the one and only Dr. Molly Fantasia, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. We'll tell you about the who, what, when, where, why, and how of Innovative Medical Associates. We'll go over some cases, and we'll do a whole lot of talking about how we can get you and your family to improve your quality of life. Dr. Molly Fantasia is here, and she welcomes your calls at 855-839-1210, 855-839-1210. At any time during the course of the show, feel free to call in and have a question, or you want to run by a medical challenge that you're having with Dr. Molly, feel free to do so. 855-839-1210 is our number. And as always, Dr. Molly, it's the right place to come if you want to get healthy.
It's great, John. Of course, of course.
And how do you help people get healthier or feel better?
Quality of life.
Quality of life?
Yeah, quality of life. Well, here's the thing, John. I work with a wonderful group of healthcare providers who are like-minded, and they all work out of my facility, which is a primary care facility. So therefore, we can do anything that you would normally do in a primary care facility. If you need a blood pressure med, if you need an antibiotic, if you need some other type of medication in order to help improve or get you through a medical issue, we can do that. But it's our philosophy that really makes the difference. What we want to do is use the least amount of pharmaceutical agent to help you correct your medical challenge so that we can reduce the side effects, not just from the medical challenge, which we can do, but we can also reduce the side effects from the pharmaceuticals.
We're all familiar with side effects because how many times do you get a prescription? I just looked at my prescription the other day, and there was 10 things that it could have done.
Yeah.
Doesn't do any of them, but it could do this, it could do that.
Right.
So
interactions.
You're kind of like bypassing that.
Well, we try. We try to help a patient reduce their need for pharmaceuticals, or at least reduce the dosing if necessary for chronic conditions, so that hopefully they don't have to worry about so many of those side effects. I am never going to tell a patient, and neither would any of the medical providers in my facility, not along the healthcare providers in the facility, to tell a patient to please get off of your medication. We're not going to do that, John. What we will do is, with the help of the physicians, help a patient reduce their need for the medication, like cut it in half, cut it in thirds, if we can, by utilizing God's ingredients or natural substances.
And you do this with hydration.
Hydration is the key. And hydration is the key because we're able to deliver an appropriate amount of the natural substances that are everywhere, believe it or not. God's provided them. God's given us a Garden of Eden right here on earth right now. And here's the thing. We're able to do this in a way that keeps the patient safe and get an appropriate amount to effectuate the change. Most people complain about vitamins, minerals, amino acids when they get them. Oh, it didn't work. It didn't work. Well,
I've heard that.
Right. Oh, it didn't work. It didn't work because A, you're not using the appropriate amount of it, and B, you could probably swallow the river and not have a proper amount. You have to reach a therapeutic level of the particular constituents, means the ingredients that actually affect the change. Otherwise, no good.
The key is, and you've talked about this often, the key is that your protocols are what makes the difference in the hydration. In other words,
absolutely,
what you put in
Right.
And it's proprietary.
Right.
We
The
understand
synergy of certain nutraceuticals. And yes, it's proprietary. Sure, we all know about Myers cocktails. We all know about vitamin C. What many people don't realize is that for some people, high-dose vitamin C is 50 grams. For others, it might be 150. So it really depends on what quote-unquote recipe, traditional recipe. By the way, those recipes have been around for 100 years. I've only been around 26 years. But I'll tell you, we've pretty much perfected our recipes in terms of what is appropriate based on lots of data that we get from their blood work, from when we sit down with them, and when we do the first trip.
How do you figure what goes into what? That's always fascinated me.
Now, because we've got to look at, first of all, I believe in listening to our patient. We've got to hear what their goals are, because what goes into what is, can we effectuate high blood pressure coming down with certain nutraceuticals? Yes. But I have to listen also, because maybe the hypertension isn't the primary issue that they're here for. They may say, you know what, Dr. Molly, I feel that fatigue after taking these hypertensive meds. So now I have to think about this. What would keep the patient safe? What can I safely do to improve the fatigue level, as well as utilize the nutraceuticals that will bring down the blood pressure? So there's an art to this as well, John. It's not just cut and dry, throw it in, and look at the recipe and throw it in. Not so much.
The art is, first of all, you're a scientist, so we should mention that.
Yeah, that's true.
And you have 2 PhDs, so
well,
we'll
not
also
worried.
mention that.
Yeah,
but,
well, I also have a PhD
in
in terms of how many people we've treated over the years. And I was lucky enough, and I say this all the time, lucky enough to work with some of the smartest physicians, particularly in the beginning of my career doing this, who really were not afraid of looking at these nutraceuticals the way they were written back then and saying, hey, Molly, you're right. This might improve the action of this. I say, well, can we do it? Yeah, let's try. And there it is.
So you've kind of perfected this over the years as well.
I've tried.
26 years, as
26 years. Unbelievable.
Did you ever think you would be doing this for 26
John,
years?
And you know what? It feels like yesterday in many respects.
Yeah.
It's because I'm always hit with new challenges, new people, but it's the same old story. Here's the thing. And it's worse now because of the state of medicine today.
Yes.
Our physicians' hands are tied many times. In the old days, the standalone physician was there, but now it's all going by the wayside because everything is being bought up by the big systems, and everybody knows that. It's not a secret. And it's institutional medicine, baby.
Yeah, remember the days of we had 2 doctors on each
corner.
Yes.
Yeah. and they knew each other too.
Yes, that's
and
right.
if they need to borrow something, they would give it to each other.
Right.
Those days are over.
That's right. So it's no longer. But how do people navigate this? I mean, how can they expect, or what can they expect when they come in to see you?
Well, I think first things first, John. I think the free consult is very important. And the thing about it is, I try to give people enough information about how we would approach their problem. But I'm finding more and more people are coming in, and really what they want to do is they want information from me, and then they want to go out and do it themselves. That's the worst thing you can do.
Oh, yes.
Okay, because you're not really listening to me in terms of, I can give you a list of a bunch of nutraceuticals. We're back to the same problem. We've got to implement them in a way that's going to help you correct the underlying issue and also be cognizant of the fact that you want a quality of life. So I need to know about that. I had three consults this week with that very same issue. At the end of the consult, they said, well, really, you didn't give me enough information to go out and buy my supplements. I said, that's not what I'm all about. I can give you a list of supplements to go buy. I said, stay here 1 minute. I'll go get the list. You can get it off the internet. Right? That's not what I do. I want to hear what your goals are. Where are you? What are you taking right now? What brands are you taking right now? Because I need to know that in case we have to tweak those as well as the hydration. So there's so much that needs to be done.
And if they get it themselves, how do they know how much to take?
They
That's
go
the
by
question.
well, they go to Dr. Google, and here's the issue. I mean, look, everybody goes to Dr. Google today, and is it good? I believe information is power, of course. But what I do believe is that when you're going to use things like medical hydration, I'm not talking about going to the spa and getting a beauty treatment IV, getting collagen alone. I'm not worried about that, nor getting your drunk mixture. I'm not worried about that. But when you have a challenge of any kind, I am worried that you're going to codepend on that IV and say, medical hydration doesn't work. That's because you're not getting it.
Right.
Yeah.
Okay, we are coming up on our first break of the morning. The show is Health Watch every Sunday, 8 till 9, here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the Ph.D. doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Do you have a question for Dr. Molly or a medical challenge? 855-839-1210 is the number, 855-839-1210. And, you know, we always tell you, call early so you don't get shut out. And, well, that's the same today as it is every other Sunday. 855-839-1210 is our number. With Dr. Molly Fantasia, I'm your host, John DeMasi. We will come back with more Health Watch after these words. Hi, I'm John DeMasi, host of Health Watch, Sundays on Talk Radio 1210 WPHT. If you or someone you know is battling cancer, long COVID, or an autoimmune condition, medical hydration therapy may help to reduce chronic symptoms like pain and fatigue, so you or your loved one can live a better life. Dr. Molly Fantasia and the healthcare team at Innovative Medical Associates have helped thousands of patients to improve their quality of life. They prescribe and deliver vitamins, minerals, and medications directly into the bloodstream where they can best impact your overall well-being.
We can bring a patient to a better quality of life and then a healthier approach to their entire condition.
Tune in to Health Watch Sundays at 8 a.m. and 4 p.m. to ask questions and learn more about the benefits of medical hydration therapy. Visit innovativemedicalassociates.com to schedule your free in-office consultation with Dr. Molly Fantasia today. We are back here on Health Watch, and as always, operators are standing by at Innovative Medical Associates. And if you would like to call right now and schedule your free consultation with Dr. Molly, 856-489-0505. That's the number. Again, 856-489-0505. Call and make that appointment, as I said. And, you know, you'll find that's where you get a lot of your information, and it can help you make a decision as to whether you want to move forward or not. So that's very simple, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that as well. Check that out. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going to go to the phones and talk to our buddy Frank in the Northeast. Frank, where you been?
Frank.
And how have you been?
Frank, we missed you last week. We missed you last week.
Well, that's one of the reasons why I have a challenge, okay? But good morning, first of all, to my favorite duo, Dr. Molly and Mr. John DeMasi, my favorite duo.
All right,
okay.
I have a question for you, Dr. Molly, and also a challenge. February, first of all, this goes out to Dr. Molly's fantastic listening audience, which covers Maine to Maui, from Florida to Alaska, including that Chinese spy balloon floating around. If you're listening to a balloon, give us a call.
Okay.
The challenge is, February is a lot of different things. One is Valentine's. I want everyone who has listened to Dr. Molly in the past, who she has helped, whether by radio or in person at the Innovative Medical Associates, to call in, make it Dr. Molly Appreciation Month. You got today and 3 more Sundays.
Okay.
Give a little love. Dr. Molly has always loved us and helped us. I want all her listening audience to show appreciation. We all talk from Dr. Molly. Let's give a little bit during the month of February.
God
it wouldn't
bless
hurt
you.
other 11 months either.
You're the best.
But my question is, I asked you before a couple of years ago, but has there been any changes with stem cells regarding retinitis pigmentosa? Any advancements?
Frank, I look at this at least once or twice every other month because of your case. And honestly, I haven't seen any recent published data. It could be because what's happening, and you know this, the FDA is all over everybody. These actual studies have to be done from a large institution. And, people have actually, I think, the COVID, I hate to say the word again, COVID. The COVID has dried up many of the studies, I think, that were going on because they really couldn't get the people to come in and do the follow-up, etc. So I think what we are right now, Frank, is in a little bit of a moratorium. I suspect later in the year, we're going to see the resumption of a lot of these studies and maybe even see second-tier studies that were started prior to the COVID, and maybe that will help you a little bit more. It's a very challenging condition, and you ought to let the people know what that affects, Frank. Tell them what happens for you with your condition.
Well, it was diagnosed in 2000. It was very minor, but it's a progressive and degenerative disease, meaning I see a difference month to month, where at this point,
right,
all I see is pretty much light, maybe a shadow or something like that.
That's terrible. Terrible, Frank.
I know. And let me say something, Dr. Ma. I heard this before. It's my opinion for a long time. And I was talking to a doctor who's a holistic doctor. He's also an MD, but practices holistic medicine too. America is great when it comes to acute care, like something new. Yep. When it comes to chronic conditions, we're one of the worst.
I know that's true.
Yeah.
That's really the truth. Yeah. And you know what else? We don't want to spend the money in something that isn't affecting enough people to make it worthwhile for them to come up with a new, let's say, pharmaceutical or immunotherapy or something like that. We just don't want to do it. And
Dr. Molly, you know the old expression, orphan drugs. If big pharma ain't going to make money out of it, they ain't going to waste time.
You got it. That's
right.
You got it. Now, I didn't say it. You did. And many of my patients do say that. And you know, and I know, that's all. Listen, we had an old friend who was my patient for a long time. You remember what Irv used to say? Follow the money. Yeah. Follow the money. He was great, and he was right, and we're seeing that. And we're seeing it in the cancer-driven stuff right now. I mean, every time I turn around, there's a new study out there, and I have a wonderful cancer patient right now who's in my chair right now, Jane, who has a 4-stage pancreatic cancer. Every time I turn around, they're trying to lasso this girl into another immunological study. Now, hear this clearly. Her oncologist, who happens to be a very bright woman, has told her repeatedly, stop, enjoy the life you have right now in this moment, because you're not going to make it through those particular studies. So you and I both know, why are they doing it? Because they can. I'm trying to give her a little quality of life. I can't cure the cancer, and I doubt that any of these studies are going to cure cancer. So,
hey, Dr. Molly, this doctor I was talking to, he's a good guy. He's on City Line Avenue.
Sure.
He says for every person diagnosed with cancer, they make $150,000 or more out of them. They don't want you to get better. They don't want to cure you. They want you to live suffering.
Exactly.
Right.
I can't cure, but I'll tell you what, I have and absolutely improved the quality of people's lives.
The only doctors I like and trust right now is Dr. Molly, my chiropractor, Dr. John Manick, and two naturopathic doctors, Dr. Paul Hopkins and Dr. Frederick Douglas Burton.
I'm glad to hear that. I'm glad to hear it, Frank.
God bless
you.
Good luck with everything, and thanks again for the call.
Have a great day.
Keep us posted on your progress,
right.
okay?
God bless.
Thanks for the call.
So interesting he brought that up, right?
855-839-1210, that's our number here in the studio. And we're going to spend some time on this case, Dr. Molly, because this is one of your tough cases.
Absolutely, unequivocally.
This is a new patient.
Brand new, just first treatment.
CRPS.
Right.
You're going to tell us what that is.
Right. Now, let me just say this. This is called complex regional pain syndrome. So we're going to refer to it as CRPS. It's a condition that affects many people, but it's currently not well understood in the traditional world. And I'd like to talk a little bit about how this patient got to me, because he was going to another healthcare provider who had offered him an IV treatment of a drug in a subclinical type dose, but truly a very, very virulent drug that they use in anesthesia called ketamine. And it's something that we agree with. I mean, you won't hear that. I have one of my medical directors was board certified anesthesia. So, of course, we believe in ketamine and ketamine D. This poor guy was sitting down to do the ketamine, and he is on an opiate right now. And a small amount. He's very judicious in his pain medication. You can imagine why he does this, because he has pain, just the way I'm talking about it, chronic regional pain. That means from head to toe, he's in pain. And in fact, even when we were inserting the IV, the girls had to be very, very gentle, because even a soft touch can set his pain syndrome off. So you can imagine how complex this case is going to be. Well, he was getting ready to do it, and all of a sudden he realized that he started the IV and he wasn't feeling good, and he saw the resuscitation equipment there, and he said, you know what, this isn't for me. He was also going to a more holistic doctor who was doing things like acupuncture and acupressure, and that provider told him to come over and see me. So he came to me sort of doing even what was more traditional, as well as some advancement, which this ketamine has advanced in this area. It definitely works for some people. But anyway, this complex thing comes after an injury or a surgery or a trauma. In his case, he actually had surgery, an orthopedic surgery that started the whole thing. He had a change in his metabolics, and something happened where he started to have intense pain after the surgical intervention had healed.
All right. Keep that thought.
I will.
We're going to pick that up after the break, because
Good.
this is a really...
This is an interesting case.
Interesting and a tough case. 855-839-1210 is the number here in the studio. Dr. Molly is here and ready to talk to you at 855-839-1210. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Again, 855-839-1210. We do have some open lines, so you can get in here and go over your situation with Dr. Molly if you like. We are coming back. We're at the halfway point of the show, which means we have half to go. More Health Watch coming at you with Dr. Molly and yours truly, John DeMasi, after these words. We are back here on Health Watch, and again, operators standing by at Innovative Medical Associates, and their number, 856-489-0505 is the number, 856-489-0505. You want to call and make your appointment for the initial consultation, which is complimentary, with Dr. Molly. And again, that's where you really learn what she can do for you and how it can help your situation. 856-489-0505, 856-489-0505, and the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Health Watch is the show, Sundays 8 till 9, Talk Radio 1210, WPHT. The number here in the studio, 855-839-1210. If you have a question or a medical challenge that you want to run by Dr. Molly, feel free to call 855-839-1210. We're going to continue this case that you've got, Dr.
Right.
Molly, which is CRPS.
And by the way, this gentleman's fairly young. I mean, he's in his 60s, John. And again, we can trace this back to the surgical intervention he had. So let's think about this. Why would an integrative physician, obviously a physician who's using a therapeutic like giving him escaped me, John, because I'm thinking about his case. But anyway, the gentleman is giving him the particular type of protocol that he's using, which is using homeopathics that he's injecting into this guy and utilizing this. Why would he send him to us? Well, one of the things that I started looking at was what is out there? What kind of data is out there about medical hydration? Well, interestingly enough, I started to do this research from early last week, actually, when he called before the appointment. And one of the things I found is that there was an obscure actual article in PubMed that said vitamin C may prevent CRPS in trauma and orthopedic care. So what they're saying is if a patient had some dosing of vitamin C prior to the surgery, which, by the way, they usually tell you, no, don't take it, it has an effect. But anyway, in this particular thing, they found that for chronic pain, they may be able to reduce the pain. So that was one thing I found. The other thing is this was a study on the efficacy and safety of high-dose vitamin C on CRPS in extremity trauma surgery, okay? And they did a meta-analysis, which means a small group, but it was very interesting that they gave the patient a daily dose of vitamin C at 500 milligrams, which is very low, as you know, okay? And it can be very helpful in foot and ankle surgery to avoid getting this syndrome. So that started me really looking at this and looking at the literature out there. So first, I guess, what we need to really assess is, does the patient have that and he doesn't have something else like fibromyalgia or chronic fatigue syndrome? So you do that, you rule that out by looking at his blood work, looking at the x-rays, those kinds of things. You make sure he doesn't have arthritic conditions that are causing this problem. So this patient didn't have any of that. He came in very complete with everything I needed to move forward, and actually came in with the diagnosis from the other healthcare professional, which helped. So I started thinking, how can I help him? Can I ever make this pain syndrome go away? The answer is probably not, but can I help diminish the pain? So I think I can help that and help diminish his flare-ups. And one of the ways I would do this is to utilize some of the conventional treatment, like the physical therapy, obviously.
Yes.
Okay. He might need to do some meditation, those kinds of things, and we would look at that. In addition, the mental health piece of this. But I'm very interested in the hydration piece. So I would look at utilizing a particular extract of vitamin C for this gentleman and deliver it in a particular dosage. I would look at utilizing magnesium for this gentleman because there's some data to show that magnesium cuts some of the pain. What else would I do? Well, looking at this and looking at acupuncture and some of the homeopathic injections that he had, I asked, did that help him? Some did, some didn't. So I started looking at the constituents of certain things, like boswellic acid, that comes from frankincense. That's something I might use. Turmeric, I might use. Why? I need to put out the fire. What is this all about, John, again?
Inflammation.
Amen. Inflammation. How it started, inflammation. I probably would look at peptides. And do you know why? Because peptides work on a particular gene peptide, not only the anti-inflammatory, but it helps with calcitonin. And calcitonin, if you've heard this before, lots of people use some things, drugs that are made for calcitonin, in order to do what? To actually decrease the pain that's associated with pain from osteoporosis and those kinds of things. So it causes an imbalance. If the decrease in the calcitonin peptide causes the patient to have pain because it increases the norepinephrine. So the norepinephrine is in response to pain. And you know what this goes back to? I have to make this simple, folks, for you and for me. I have to look at this and say, it's the Goldilocks theory again. You can't have too much of one thing and get the body out of homeostasis.
You said something about vitamin C earlier.
Yes.
And I want to know, is it a different type of vitamin C?
I'm going to use a listen,
combination?
vitamin C is vitamin C is vitamin C, but I believe the body responds more to the natural vitamin C's, the kinds of things we used to get in oranges when we used to not have them be around for 20 years, the kinds of things we get from tapioca, the kinds of things we get from cassava, the kinds of things that we can get from beets. So I'm looking at all of those and utilizing the ones I think are more anti-inflammatory in nature for someone that has some of the problem he has. So I'm looking at brain balancing him using the peptides and the amino acids, right? Because we've got to get those nerves to kind of calm down. Probably I'm going to look at something like alpha lipoic acid. Now, the key to this is how I put this together, the synergies of some of the things I talked about, the dosing of some of the things I talked about. So this is going to be a very interesting case, and I almost have to do this treatment by treatment with him because this is sort of new ground. If this does what I think it's going to, and I've helped people with pain syndromes in the past, just nothing quite as complex as his particular pain level. And if this is going to be a very interesting case, and I'm not done yet, John.
I'm just curious as to how you figure out what is going to be with what.
Well,
and that's
I had
proprietary.
to do right
in
now.
case.
I actually am going to put a proprietary blend together for this particular case that I think I will use with most of these, assuming that they fit that criteria. See, here's the thing: you can't say you use everything for every anti-inflammatory for every inflammatory condition. You've got to start to be judicious in what I put in the bag at what period of time. So this is going to be one of those cases. And interestingly enough, there was an old-time remedy that people were using for this that I went back to the 60s, and it was horny goat weed. Now, I've heard this before for men's health because it helps men open up vessels and deliver oxygen, which I want to talk about when we come back from the break. But this is an interesting kind of thing. So it balances out the vessels, which means it delivers more blood, which means it can potentially reduce pain.
Is this patient going to be a lifer?
I would say he's already a lifer. He just doesn't know it. I mean, he's been a lifer in seeking out treatment for this challenge. And here's the thing. I think the way to look at this is we're not going to cure the problem. It's complex. It's complex regional pain syndrome. It is a syndrome. He's going to have this probably the rest of his life, or it would have resolved after the surgery.
Yeah.
But what I want to do is actually maintain the pain level for the most part for a longer period of time that he's relatively in less pain. I do not think that what I'm going to put together is going to cure his pain totally, but I bet it's going to make it a lot more livable.
Right now, he's at a pain level on a scale of 1 to 10.
Plus 10. Over
Plus
that.
10.
Probably 10 times
So
that.
what's your goal?
My goal is to bring him back to about a 5. Yeah.
That's pretty significant.
It can help his life. I believe it can give him quality of life, and that's actually what he's looking for. He got it because that's why he sought out the other types of treatment, you see. So I get it. He's a great patient to do it. He had a wonderfully supportive wife. I know we can do this, and I have more to talk about if we have a break very shortly.
Yeah, we do have a break. In fact, we'll take it right now. Health Watch is the show. Every Sunday, 8 till 9, Talk Radio 1210, WPHT. 855-839-1210 is our number here in the studio. You still have time to jump in here with a call or two if you like for Dr. Molly, whether it's a medical challenge or you just have a simple question. 855-839-1210 is the number. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. I'm your host, John DeMasi. We're coming back with more of today's edition of Health Watch after these words. We are back here on Health Watch. Operators are standing by, and they're going to be there well after we leave you at 9 o'clock this morning. 856-489-0505 is their number. 856-489-0505. You can call now, or you can wait till after 9 o'clock if you will like to call them then. Or you can call them tomorrow, but make sure you call them 856-489-0505 and schedule that initial consultation with Dr. Molly. And, of course, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And we remind you, if you miss any of today's show, you want to hear it again, or you heard it all and you want to hear it again, sure, that's fine. 4 o'clock this afternoon, Health Watch replay, 4 till 5, right here on Talk Radio 1210 WPH.D. Got a couple of minutes left of the show. 855-839-1210 is our number here in the studio. And this case that you've been talking about is fascinating. And CRPS.
Right. And in addition, so we talked about what some of the ingredients in the hydration is going to be. But I'm going to do something a little differently with this. I'm going to increase his blood oxygen levels while doing this. And how are we going to do this? We're going to put him on on pure oxygen while he's sitting in the chair while he's getting this IV. Now, I've done this before for other types of conditions because by increasing the oxygenation in the blood, okay, I'm going to ultimately increase the oxygenation in the cells. So one of the things that I'm going to do is increasing these things. I'm looking to increase the beta endorphins. That helps stabilize blood sugar and causes damage to the nerves and blood vessels while this is all going on. I don't want to do this. So when a patient is depleted of oxygen that's stored in the blood, like old oxygen, in other words, we take the deep breaths, but we're really not getting enough oxygen to sort of switch it up to the new good oxygen that we need to go to the brain. Remember, it's converted into blood oxygen through the lungs. So obviously, if you're in pain, do you think you take shallow breaths? Yes. So I'm going to help this person while he's in the chair. And in doing so, getting to the central neurological condition that's causing this, his autogenic, his sympathetic, and his inactive. If you remember, I spoke about that last week in POTS. So there's some carryover here. It's very interesting. So by increasing the oxygen in his blood, I hope to reduce the CRPS and deal with the symptoms that he's having, not necessarily cure the disease. This is a little different than the traditional treatment. I also want to use the physical therapist in our office and possibly help this while he's getting his IV, if at all possible, to come back and talk about this, and again, using some of the peptides. So this case is very interesting. I think that there's going to be follow-up on this case, and I think I'm probably going to write this case up because this is the kind of case that other people say, well, there's nothing you can do after a certain point. You can't expect the pain management guy. The thing that will happen is they want to increase the opioid. And this guy, I really like working with him because he stayed steady in his opioid dose for more than 2.5 years. That tells me he's committed to looking at other kinds of ways to treat this condition that would be less, let's say, less hard on the system, John.
Let's hypothetically.
You could try hypothetical, brother. But
so let's say a patient, not this patient, but let's say a patient listens to you and says, "Oh, turmeric, this, that."
Yeah, go ahead.
I'm going to get each of those, and I'm going to take some of those. And it's not the same thing at all,
No. The reason why I gave these is because we know they're anti-inflammatory. That's not new news to our listeners.
Right.
They're anti-inflammatory. But I didn't mention things like the lymphatic drains that I have to use, which are proprietary in nature.
Yes.
Those kinds of things. Also, utilization of the peptides, utilization of grapeseed extract. I didn't say that because it's a question of the synergies of these various types of anti-inflammatories along with the oxygen therapy. And again, I'm cognizant. I have had a physician call and say, well, you're going to make your patient oxygen dependent. I got to tell you, we've used oxygen in our clinic for probably 20 years and never made anybody oxygen dependent. If anything, we made them feel better. So, here's the thing. I'm not telling people to throw away their pain medication in a situation like this. I would like them to stay steady with it because we all know it's getting more and more difficult, even for the pain management guys, to order these opioids. We know it. It puts you on the red zone, in terms of the pharmaceutical, and it tortures the pharmacists. God bless them. I want to help people. We want to keep them and reduce the pain. I can't cure this condition. I am not saying we can, but if I can reduce his pain even a third, this man will have a better quality of life.
And again, you're looking at,
overall quality of life. We're looking at a pain level that's way beyond the traditional pain scales.
What the use of peptides? You're using them?
Yes.
How are they fitting into
this?
Because
they're going to help. What happens is they have a decrease in calcitonin peptide. It's a gene. It's a particular gene. It's called GCRD. I don't want to get into the big, lengthy deal with this because we could spend another whole show in technical crap. The point is, what we want to do is use a peptide that will bring the body back in balance, decrease this particular peptide, and increase the norepinephrine. So, what we want to do is we want to impact certain things so that it becomes Goldilocks in nature, just right. Not too much epinephrine, not too much decrease in the calcitonin gene peptide. So it's a just right kind of thing. So again, this is sort of complex, John, but if we bring it down to the basic terms, we're looking at trying to get his inflammation under control and doing it in a way that works for this particular condition.
Now, how long, you had said earlier...
he's a lifer.
Yeah, but how long to get him from the plus 10 pain level to a 5 that you're hoping to get him to?
Well, I'm going to say
6 months at least.
I would say at least, and he's been at this now for months and years actually. So I think it's a question of looking at the neuroamino acids, looking at his pathways, utilizing things that we know work on the nerves that calm down the nerve inflammation. So this is going to be the kind of thing. And I told him straight out, look, I don't know if we can help you in a situation. I know I can decrease the pain. I don't know how much. I'm going to try my best if you try yours. And he was agreeable to that.
And, we should mention that a lot of people do come in to see you for the consultation.
Sure.
And they figure they can get the information and they can do it themselves. And just briefly talk about, you've spent years on this.
Listen, just... Look, it's a matter of taking all the information, looking at what he's already done, pulling together the chart, looking at what else we can do to improve his quality of life. And the bottom line is, I believe everything's in the man upstairs. God is in control. He will help me decide when this is enough. And maybe if I can help him a third, I believe that'll be a win for this clinic. That's how I believe. And and I have him on the prayer list too. So listen,
Okay.
That helps, John. There's the real peptide.
That's right.
Okay?
That helps. And with that, we are putting the wraps on another edition of Health Watch. Don't forget, Dr. Molly is available during the week. You can call now, 856-489-0505, 856-489-0505. Call now and schedule that initial consultation, and you will be surprised at how much information you get out of that. 856-489-0505. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, we're on again this afternoon at 4. It's our Health Watch replay. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, our nursing staff, Barbara, Lana, and Catherine, and Donna, and then there's delightful Dee, and fabulous Fran, and Joanne, and our medical assistants, Sandra, and caring Kathy. I'm your host, John DeMasi. Thanks for listening. Have yourself a safe and a healthy week, and we'll talk to you next Sunday, 8 till 9. Health Watch, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.